Welcome back to ESPN West Palm tonight here on ESPN 106.3 and the free ESPN app. Cyrus Wittig here with you until 7 o'clock, and right now I have the pleasure of bringing on Dr. Zahra Khan, a general surgeon who was fellowship trained in endocrine surgery. Dr. Khan works with Palm Beach Surgical, a general surgery practice in Delray Beach, and she is also on staff at Delray Medical Center. Dr. Khan specializes in thyroid cancer, parathyroid disease, thyroid nodules, adrenal tumors, functional adrenal, adenomas, calcium disorders, and Graves' disease. Hopefully I pronounced some of those correctly. Dr. Khan, thank you so much for taking the time to speak with us tonight.
Thank you so much for having me.
Dr. Khan, I want to start by going over to Europe, talk some soccer, which is pretty topical with the World Cup going on. Women's Super League champion and Chelsea goalkeeper Ann-Katrin Berger, at just 32 years old, recently underwent treatment for thyroid cancer and is sharing her story and returning to soccer. Dr. Khan, first of all, just give us some background on what thyroid cancer is and how it develops.
So thyroid cancer is a really broad term, and it applies to a few different subtypes of abnormal growth of cells within the thyroid gland. This has nothing to do with thyroid function or the increased or decreased production of thyroid hormones. We aren't sure what causes it, but like other cancers, it is the increased growth of abnormal cells that develop into tumors, which we refer to as nodules, within the thyroid gland. The vast majority of these cancers grow extremely slowly compared to other cancers like breast or colon cancer. And because of this slow growth rate and the fact that thyroid cancer is rarely as aggressive as other types of cancer, people do really well, and there's a high cure rate.
Yeah, it's thyroid cancer. It's personal to me as well because my girlfriend actually had and recovered from thyroid cancer at the age of 19. So
Wow.
back to Chelsea goalkeeper Ann-Katrin Berger, who underwent the treatment at 32, and then my girlfriend who had it at 19. I mean, is it out of the ordinary for women of those ages to deal with thyroid cancer?
It actually isn't. Although there's 19 and 32, it's a very young age, especially to hear someone at that age having cancer. It's really scary. And most thyroid cancer does affect women in their 30s to 60s, but thyroid cancer is actually the most common type of cancer in women between the ages of 15 and 34. And it really can affect people of any age. It even affects children with a genetic predisposition. The incidence of thyroid cancer has been steadily rising for the past 4 decades, and we're not really sure whether that's because of some unknown environmental factor or if we're just getting better at detecting it.
That is so interesting. Little creepy, little intriguing, but definitely interesting. Again, Cyrus Wittig here on ESPN West Palm tonight, speaking with Dr. Zahra Khan, endocrine surgeon at Palm Beach Surgical. Doctor, what are the symptoms of thyroid cancer, and what tools do you use to diagnose it?
It's strange in that there really aren't any symptoms. A lot of people have thyroid nodules. A lot of women have thyroid nodules and don't even know them. It's not screened for like other cancers, so it really is a silent disease. It's usually found after a physical exam, or if even someone themselves notices that they have an abnormal growth of their thyroid, they would just feel it in the office, or it can be found on imaging studies like ultrasound, CT scans. Sometimes these are done for things other than the thyroid, and then we find these nodules incidentally is what we call them, because we aren't looking for them, but we find them. And then the diagnosis would involve a needle biopsy to get some cells from those nodules. And then the pathologist looks at them, and if they do seem suspicious for cancer, further genetic studies can be done to help stratify that risk and come to the diagnosis.
Dr. Khan, what are the treatment options for thyroid cancer? Is there a surgical versus non-surgical approach? And when does surgery become necessary to treat the condition?
The most important part of the treatment of thyroid cancer is the surgical removal of the gland. There is a bit of gray area regarding how much of the gland should be removed. In other words, the entire gland and the associated lymph nodes should be removed for most cancers, but in select cases in which the tumor is very small and the cancer is not an aggressive subtype, patients do just as well with removing only the affected half of the gland. And like I said, although surgery is almost always a necessary part of the treatment for thyroid cancer, except for some very select cases, this is something that should be discussed further with a physician. and decided upon based on a case-by-case basis.
Gotcha. So with that being said, with surgery being the majority of the time being necessary, what's the timetable for recovery from thyroid cancer?
So recovery is different for everyone, but overall people get back to their new normal relatively quickly following treatment for thyroid cancer. The most important part of the treatment is surgery to remove the thyroid. In general, people do very well with that. They usually come in the day of their surgery. The surgery takes a couple of hours. Afterwards, people can talk, eat, and move normally, and usually they have a sore throat for a couple of days. The hospital stay is almost never longer than 1 day, but I tell people to take a week off from work to recover back to their baseline, and afterwards, if further treatments are needed, it would be in the form of a pill of radioactive iodine given a few weeks after surgery, and thereafter, it's just a matter of making sure that the cancer doesn't come back by keeping regular appointments with your doctors to get blood work and ultrasounds done. Thyroid cancer doesn't recur very often, but it's important to monitor for recurrence so it can be appropriately managed.
Again, I'm here with Dr. Zahra Khan, who specializes in a variety of fields, including thyroid cancer. Dr. Khan, back to Chelsea goalkeeper Ann Katrin Berger. She said that the mental health and her physical health that became important to her during the game of soccer and as a professional athlete, was also an immense help to her when battling cancer. How important are those factors, diet, mental health, eating right, and exercising when fighting conditions such as thyroid cancer and some of the other things that you deal with?
So cancer it's very stressful. It's a life-changing diagnosis, even with something like thyroid cancer, in which most patients do exceptionally well. And like any other major health setback, having a good baseline is critical to both attacking and overcoming the disease. I believe that, mental, spiritual, physical health, it's all related, and it's important to include addressing all aspects of health to just obtain the best quality of life. So there's no clinically proven diet to help with specifically fighting thyroid cancer, but nutrition is important for overall wellness. So I think optimal nutrition, physical activity, these are critical aspects of wellness and should not be neglected, especially when so much energy just needs to be put forward into both fighting cancer and then recovering from it. So, yeah, I think it's important.
Again, and on the same kind of category, Berger also pointed out her strong bond with her significant other, helping her through tough days. Like you said, it's a tough battle. How important is that support system, friends and family and loved ones when you're going through something such as that?
It's vitally important. It's like you said, it goes along with this idea of optimal health, and that involves taking care of not just the physical, stuff that we go to the doctor for, where we get our medical treatments, but taking care of your emotional health, your mental health, spiritual health, and having a good social network is so important for a lot of those factors. It's like any other major life stress. You need to have your people behind you to give you perspective and support you in that journey to recovery.
Wrapping things up here with Dr. Zahra Khan. Doctor, as I mentioned at the outset, you specialize in so many things: thyroid cancer, obviously, parathyroid disease, thyroid nodules, adrenal tumors, Graves' disease. This may be a silly question, but how much overlap is there between all of the conditions you work with, if any?
So I do treat a wide variety of conditions, but it really all boils down to anybody that needs surgical treatment for their adrenal glands, their parathyroid glands, or their thyroid is something that I treat. So it encompasses basically everything, all of those conditions that you just said.
What was the path to becoming, an endocrine surgeon, general surgeon? How does that maybe differ for some other fields of surgery?
You do a general surgery residency, just like any other general surgeon. And then there's a year fellowship during which there's a special focus on the surgical treatment of diseases of the thyroid, parathyroid, and adrenal glands. And it just involves some extra training in that specialization. And it's a field that, I was attracted to because although a lot of the patients come in with very stressful conditions like cancer, most of them do very well. And I love seeing that. I love seeing my patients do well and be cured of their cancer. So it's very gratifying.
You work on so many different ailments and conditions, Dr. Khan. When you look towards the future of medicine and new technologies, new techniques, what's one thing, I know there's probably many, but what's one thing that really excites you most about the future in the medical field that you work in particular?
I think as we move forward in the future, we're becoming a lot more precise with both the diagnosis and the treatments of disease, and learning more about the genetics of disease and different environmental factors that come into play that can affect not just developing disease, but also how we recover from it. So I really look forward to us as a medical community just learning more about the interplay between how we experience things physically and how it's related to our mental health and our emotional health. So that's what I most look forward to, I think.
Dr. Khan, we are here on ESPN 106.3, so I have to ask, are you a sports enthusiast? And if not, what are your hobbies? What are your passions in life when you're not busy as an endocrine surgeon and saving people's lives?
So I don't play any sports myself, but I love watching football and ice hockey. I'm a fan of the Philadelphia Eagles because of where I grew up, and I actually really love the Florida Panthers. But in my free time, I love yoga, cooking, baking, reading. I really love poetry and literature, and then just spending time with my friends and my family.
That's awesome. Well, next time we have you on, Dr. Khan, we'll have to get into football and hockey a little bit more, but we're running out of time. Before I let you go,
Definitely.
Can you tell us a little bit more about Palm Beach Surgical?
Sure. We're a group of 5 general surgeons with subspecialty training in minimally invasive techniques, colorectal surgery, bariatric surgery, and endocrine surgery. It's based in Delray Beach, and I joined this group because of my associates' commitment to providing high-quality care for patients with surgical disease, and because of the excellent reputation of this group and taking care of the Palm Beach community. So it's something that I am very excited to be part of now.
Dr. Khan, we were very excited to have you on, very grateful for taking your time. Again, really appreciate all the information and the insight, and I look forward to our next chat.
Me too. Thank you so much for having me. It's been a pleasure.
Once again, that was Dr. Zahra Khan, general surgeon, fellowship trained in endocrine surgery. She works with Palm Beach Surgical in Delray Beach and is also on staff at Delray Medical Center. And Palm Beach Surgical, their office is at 16215 South Jog Road, Suite 204, Delray Beach, Florida 33484. And for more information or to schedule an appointment with Dr. Khan, call 561-448-3848 or visit pbsurgical.com. We will be back after the break. You are listening to ESPN West Palm Tonight.